With that, I'd now like to hand things over to today's moderator, John Gobron, CEO for Aventura.
Great, thanks Patrick, and hello everyone, and welcome to today's webinar. Our discussion today will focus on MemorialCare Health System strategy for quickly and securely delivering Epic, PACS, and Dragon on a roaming desktop. We'll look at how MemorialCare has improved caregiver productivity and satisfaction, and in the process, enhanced patient safety and security. Our featured speaker today is Scott Raymond. Scott is the Executive Director of Information Services at MemorialCare, with responsibility for operations, applications, strategy, and innovation. A PICU nurse by training, Scott transitioned from the bedside to physician informatics. For the past 5 years, Scott has worked on MemorialCare's Epic installs as the Director of Physician Informatics and was responsible for physician adoption, documentation build, training, and go-live support for over 3,000 physicians across 5 Epic installs. Scott holds a bachelor's degree in nursing and a master's degree in healthcare administration and informatics. So as Patrick said, a few quick housekeeping items. After the webinar, we will make sure to send you the slides. Scott will be talking for 20 to 30 minutes, and then we'll move into QA. If you do have a question, the question submit is in the bottom right-hand part of your screen. You can type it in at any time, and we'll queue them up. And for any questions that we don't or aren't able to get to at the end, we'll follow up with you directly. So with that, I'll turn it over to Scott. Thanks, Scott.
Thanks, John, and welcome everybody. So just kind of level set where we are as an organization. MemorialCare Health System is located in Southern California. We kind of border from the LA County line all the way down to the San Diego County line. For those who are familiar with Southern California, we kind of traverse the 405 and 5 corridor. So like you see on the screen, we have about 2,600 physicians on staff, 11,000 or so employees, with 3,500 of those being nurses. We have 6 hospitals. We currently have 2 medical groups. We just started our health plan. We have numerous outpatient imaging and surgery centers that kind of dot our locations. We have about 1,500 staff beds, 68,000 discharges annually, 198,000 ED visits. We also have a level 1 trauma center and a teaching facility that is primary to the system. We are an Epic enterprise customer and have employed or deployed most of Epic's modules, as well as their ASAP model in the ER. Kind of the main focus of the ER is our PACS system, our Dragon medical dictation system, and the platform that we've leveraged for roaming Epic is VMware View. So live at MemorialCare in 2015, we've kind of transitioned from EMR adoption to really EMR optimization. And part of our optimization efforts have focused on ease of access for clinicians and trying to give them time back to the bedside and time back to the patient. And part of that is to allow faster access to that information. You know, clinicians are constantly seeking out information to do their patient care, and the EMR, of course, is the kind of the bedrock of that information. So anything we can do to improve the access of the EMR goes a long way to improve patient care. So challenges with roaming Epic. You know, Epic has, in their 2014 release, they have a switch you can throw that allows Epic to roam. Epic is very careful about what activities they roam. They're very careful about how that affects others accessing the chart. So in that roaming capability, it has limited functionality because limited modules in Epic Roam. So we originally looked at turning that Epic roaming on, and after some real thorough testing with our clinicians, we found that having that turned on wasn't really going to work for us and wasn't really going to increase the access to the chart. So really what we wanted to focus on was ease of movement within the chart, and roaming allows that. So basically roaming allows you to access a place in the chart on multiple desktops and allows you to roam throughout the department that you're in and access that same information quickly on multiple desktops. So in its current configuration in most of our hospitals, Epic is deployed via Zen app. So it's published basically on the desktop in a generic kind of application that's just on the desktop where you log into Epic with your username and credentials, and then you find your patient in your patient list and access that chart. Of course, when you're done, you exit out, and then you go to another workstation and kind of start over. And so there's a lot of logging in, finding your patient, finding your activity, logging out, and then repeat. So we wanted to really find a way to be able to log into that computer, log into that session, find that patient, and go to that activity, and then take that activity with you, essentially taking your Epic session with you in your pocket while you move throughout the department and when you access other machines. So a big part of our initiatives with Epic, we call it MC21, it basically is memorial care in the 21st century. So it's really focused on patient safety, patient care, patient satisfaction, but also user satisfaction, so clinician satisfaction, including physicians. So our caregiver challenges, on the slide you'll see that, nurse is at the center of that patient care, and it really is for most departments in the hospital. But we wanted to really focus on kind of what we call the Omaha Beach of the hospitals, which is the ER. And kind of in that situation and in that environment, the clinician who's most responsible for patient throughput in that environment is the physician. So we really wanted to focus on giving physicians ease of access, and physicians in our facility access not only Epic, but they constantly access our PAC system and our Dragon medical dictation system. So being able to have those applications up and live for them while they move throughout the department, really, for us, we kind of strategized that would really improve throughput. And through our talks and kind of collaboration with our physician champion, who's the director of the ER, he thought that would be something that we could really give back to the clinicians, allowing them to easily access information quickly without having to go through that constant login process. So kind of typical IT challenges, and it's common across, it's not just an Epic issue, it's an EMR kind of issue. It's clinicians have to take time to log in and access their systems, log in and access their patient. So that requires them multiple logins and log offs. And when you're talking multiple applications, like in the case of the ER physicians, they're doing that same login and log off with 3 applications. So you can imagine the challenge when they're trying to rapidly triage and rapidly treat and rapidly get patients out. Anything we can do to increase that that ease of access is going to help with our throughput. So challenges from an IT perspective, we really, it's kind of that balance of access and security, and it's a fine line, and it's a balance that, every healthcare IT shop is kind of dealing with. So we're in charge of protecting the patient data, and that includes data at rest. So that would be data at the desktop level. We're also in charge or charged to help the clinician workflow. So if you put in onerous security issues or security systems, the clinicians will push back if they can't get to their information quickly. But it is a balance, and it's a balance that you have to work out as you're, through your organization, but really in collaboration with your clinicians, because without their feedback, you can put in any system, but if they don't adopt it, you're going to have trouble. So what our strategy was to give that access in a secure way to our physicians. So we wanted to allow them to log in a secure manner, so through authentication. We wanted to give them single sign-on to the applications that they use most, and we wanted them to be able to take that session with them, like I said, either on their badge or however you want to look at it, on their badge or in their pocket, and be able to let them take that to any workstation within the ER to access that information. So we hope to, increase physician satisfaction, but more importantly, patient care and patient satisfaction. So our strategy, to roam effectively, you need a virtual platform. So you need a VDI platform, whether that be Citrix, Zen Desktop, or what we chose was VMware View. And so you need that to be able to have a virtual session that you can roam. To be able to do dual authentication, you certainly need a card reader or a badge reader or some biometrics. We chose to use the card, the badge, because everybody is issued a badge. Everybody has the chip in their badge to get into doors and other areas of the hospital. So it was less of a lift for us. All we had to do was actually add the badge readers. We wanted to increase the speed of access to those applications. So we wanted a single sign-on solution to seamlessly log into those three critical applications. Again, we always are looking at security, so we want to secure that information or that patient care information, that data at rest. We always want to make sure that we're not exposing PHI, but we also want to be able to have the clinicians access it easily. Another big thing for us, for our physicians, is the use of Dragon. So it's an adjunct system for documentation, and we actually went live with that in 2010 at Orange Coast Memorial when we went live with Epic. Our ER physicians thought it was critical, especially for the HPI and the disposition is very difficult to template. So we use note writer functionality for their basic assessment and documentation, but we allow them to use Dragon to do supplement their note with partial note dictation, and that the ER director felt that was critical for them to be able to document purposely in the ER. The other thing that we kind of want to look at is as you're roaming, there's other things that come into play. There's printing issues, there's productivity issues, there's desktop placement, there's use of WOWs and other adjunct devices. And we also wanted to make sure that the awareness was there of who was accessing information, what's their workflow, what applications do they have access to, and we wanted all that managed in the background. Your clinician shouldn't have to know how they're getting their information or why they get that printer or why they get that application. They just want to use the stuff that they know they need to use, and they don't want it to be some onerous activity. So kind of the roaming aware desktop, and the reason we chose Aventura is that it actually has an awareness of, like I said, of the clinician, of where they are, what they're accessing, how they're accessing it, and where they want that information to go. So part of that, like I said, it's very important for that single sign-on. We wanted the ability to rapidly access that desktop, because if the clinician is getting their own desktop but it takes a long time for it to come up, that's not going to be a satisfier. We also really wanted instant disconnect, so that tap out functionality is very important because you want to not leave any information up on a screen. Obscure screen is a nice feature to have. It can obscure the screen while Epic is in their timeout period. We want default printer assignment, so when you're roaming, it knows what printer it should print to, so you don't have to walk back and forth. And we want to be able to load those applications per the user, so they only get applications launched that they actually use and actually feel that are useful. So you wouldn't want, the nurses don't dictate via Dragon, so when the nurses log in, they're not getting that application. So awareness is kind of an interesting thing to think about. And, with the Internet of Things, everybody's very aware that, their houses are connected and, you can have your lights come on when you have an app on your phone. Everyone has a smartphone and it knows, by location where you are. It knows your preferences by application. The Internet, you can set those settings. Cars have computers in them now, or you can set, each driver can have their own preferences. Even everyday appliances have smart built into them. But if you look at the traditional desktop, it really isn't smart. So it's driving to that application you want takes you time to log in, find it, and come up. It doesn't have an awareness that that's you or what your preferences are. So we really wanted to look at a system that enabled that desktop to be smart. And we found that the RAD product really gets us there. So implementation, what did it take? We really had to look at the workflow of our clinicians first and foremost, and that kind of drove what our strategy was. So kind of at the base, to roam, you need a virtual desktop application. So that's your environment that allows a user to grab a desktop and keep that in essentially in the cloud or in your data center. You want Active Directory, so it can dual authenticate and know who you are based on your credentials and your badge. And then where Aventura comes in, it looks at that and knows who you are, where you are, and what applications you are, and that is delivered at the desktop level to the user. So go over the implementation for our team. Of course, we had a project team. We always have a rollout approach. We've learned our lessons very well from Epic and those deployments. You need an implementation timeline, and you need to address end-user training. So what was the impact of that? What did it take to do? So before we looked at how long it took, we got baseline information, how long it took our clinicians prior to implementation of the roaming aware desktop. How long did it take to access from the Epic login screen, getting to the patient and the applications they needed. So we looked at in the ER how long it took most clinicians to get where they needed to go. So on average, it took about 21 seconds to log into Epic, go to your patient list, find the patient you wanted to access, open that chart, go to the place where you wanted to document. And then for the ER clinicians, if they're accessing iSight or Dragon, that's another time asked of them. So in total for an ER physician, it took about 20 to 30 seconds to get to where they wanted to go. And that 20 to 30 seconds was every time they wanted to access that chart. So after our implementation, we did that same study, and with the roaming aware desktop, it took about 8 to 10 seconds to get to where they needed to go. The other neat feature is with single sign-on, logging them into Dragon and PACS, those applications stay up no matter what workstation they go to, and that information is always accessible. So what are our next steps for our implementation? What we really want to do is roll out into the inpatient environment. So we've taken our lessons learned in the ER, and we're going to take that out to the inpatient floors and really address kind of their issues. So we're going to do the same type of review of their workflow, what applications are needed. Another big thing for us on the inpatient side, we have a lot of physicians who use speech recognition. They use Dragon in their offices and in their practices, and they'd really want to use speech recognition in the hospital. We've deployed a pilot of speech recognition in the inpatient environment, but the clinicians really want that ability to log into Epic and Dragon at the same time, and when they log out, have that log out together. Kind of a big issue with Dragon, I think we'll address it later in the slides, is profile corruption. So if somebody leaves their Dragon session open and does not close it, and the next physician comes in and opens Epic, he sees Dragon is open and they just start dictating. Basically, they step on that physician's profile, and that leads to corruption, which is a big issue for our speech recognition. So there are some technical challenges, like I elaborated on earlier on Dragon. So it takes a while to load your Dragon profile. It's accessing, for us, we have the network edition, so it's accessing your profile in the server, on the server in the data center. It takes a while for the USB connection and awareness to come up, so it loads that microphone and the profile of that user on the microphone. And then once they're in Dragon, like I said, there's issues if they don't log off. Not only can someone step on it, but a lot of times the updates and the corrections made don't get filed to that profile. So clinicians get frustrated that they think they train Dragon, but their training isn't captured. So one of the neat things that happened with adding our roaming aware desktop and adding the SSO is that it allows Dragon to load while Epic is loading. So at the same time that Epic is loading, the PAC system is loading, Dragon is loading. It also has rules about how the microphone is connected in the background. And that's really important, especially when you're roaming, because the USB connect and disconnect has to happen seamlessly, and you can't have the users waiting. The other really neat feature is you can have a graceful log off, and what that means is that when the physician is done dictating, any corrections made to that profile or any learning on that profile is captured, because the log off of that user's profile is graceful. So it stays up in the background while those changes are being made. The other nice thing is that they're roaming between desktops, Dragon stays up. As long as they're staying within the log-off period, the Dragon stays up, and you don't have that issue with the corruption or the updates. So lessons learned. What did we learn from our go live, and how are we going to apply those going forward? So really at the base, it's really important to build out your virtual desktop infrastructure carefully and mindfully. So knowing what your end user requirements are going to be, from how many desktops will be deployed simultaneously, what is your bandwidth to those departments, what does your network infrastructure look like. And we took our time, we did a lot of proof of concepts and pilots with different infrastructures to land on our current infrastructure, and we thoroughly tested that ahead of time before we deployed the roaming aware desktop. Of course, there's always the governing principles, security over access, what's that balance? And that's a decision for, compliance and risk. It's a decision with the IT leadership. But more importantly, it's a decision that you want your clinicians to weigh in on. What's important to them? How fast is that information getting to them? How important is that for them? Of course, you need executive support to put any application in. But I think any application that touches clinicians, you need a clinical champion. So in this case, we had our ER director as our clinical champion. You also need clinical involvement. So it's not enough that they support an application or they support the idea of an application that's going to improve their workflow, but they have to be involved in the process. So you need them to do workflow validation. You need them to hit the system in your labs, on the test system. You want them to be thoroughly aware of how this new application is going to affect their workflow. And then the other big thing for any big healthcare organization is you got to consider your other projects and priorities that are going on at the same time. So anything that's competing with that, so whether that be an Epic upgrade or another application go live like a lab system or a PACS upgrade, that can really affect your deployment, and you want to make sure you're careful about organizing those and planning those in a calendar so they don't compete, especially when they take away resources that are needed for your project. So at that point, I think we can take questions, huh, John?
I was going to say, thanks, Scott, and I was going to say the same thing. A lot of questions have been submitted. If you have one and you haven't submitted it, go ahead and type it in and hit submit, and we got a little box here of all the questions. But I've been trying to categorize them as they've been coming in, and they're coming in under areas like training, use, selection, feedback, and integration. So maybe if you could, I'll start with a training one, and I'll kind of encapsulate a few different questions into one. Sorry if I don't get to your exact thing, but some of the questions were on physician training. Like, how did this get rolled out? Could you talk a little bit about that, what was needed, and lessons learned in that area?
Sure. So the first part of that is the workflow validation. So we had a group of kind of champions from the ER come into our lab and validate the workflow first. So anything that came up that would affect that, we could make those changes before we deployed it. And that was critical because we kind of knew what we were getting into and what issues would come up when we implemented and when we went live. From a training perspective, we kind of did it in two ways, kind of almost like we did our Epic implementation. So we had training materials, made those available. We put that training material online so the clinicians could access it. Of course, we handed out that training material as pocket guides. And then what we really felt was important is to do at the elbow training. So we kind of did a phased go live in regards to, we had our implementation team in the ER. We would enroll a new user in the application, and we would stay there with them at the elbow as they access the chart for the first time using the RAD product. So that proved out to be very valuable. It was kind of the easiest way to get to them. It's very difficult to get a group of clinicians out of the ER into the classroom. Of course, there's schedule considerations and overtime considerations and all that. And we felt that being at the elbow was really helpful. And the nice thing about the way that this works is it's not a very difficult application to learn. It's basically using your badge to authenticate, put your username and password in, and just showing them how to tap in and tap out and what roaming means. And that really doesn't take that long. So it's not like they're learning Epic or learning electronic medical record. It's really just how you access that. And it proved out to be a good strategy, and the learning curve was pretty short.
Awesome, thanks. The next set of questions are around integration. There was a specific question, how hard was it to integrate with Epic, and there was another one on Dragon.
Yeah, that's a great question, and I probably should have hit on that in the slides. So the Roaming Aware Desktop or Aventura doesn't affect how Epic functions, and I think that's a really important distinction. So the way Epic behaves is not altered. So I guess a perfect example of that is we as an organization have Epic timeout after 5 minutes. So if you're not using Epic, it'll time you out within 5 minutes. So that isn't changed. The way you access the record isn't changed. The way you move from activity to activity is not changed. And so the rules of Epic aren't managed or aren't manipulated in any way. And so that is good. What is different is how you access the chart at the desktop level. As far as integration, we do, anytime we add something that remotely affects or may affect Epic, we do integrated testing, regression testing. So all that was part of our implementation. But as far as integration, there's not a lot of changes in Epic since we didn't choose to turn on Epic's roaming functionality. We left Epic build the way it stood prior to our go live. And was there another question about the Dragon integration, John?
There was a real specific one about microphone issues. I think you covered it in the slide, but if you could maybe touch on it just for just other, maybe microphone, or expand on other issues about, Dragon, that your slide had corruption and file corruption and microphone stuff. But is there anything else that you would expand upon, just to cover the question?
Yeah, so integrating Dragon, Dragon 1, if people are on an older version of Enterprise and Network Dragon, that wasn't built to roam, so there was issues in the roaming. When we originally tested this, that's exactly what we had. We had Dragon, our Network Edition, but we had Dragon 1 version. And so what we found when we first started roaming was that connect and disconnect of the USB devices, specifically the microphone, wasn't consistent. So we worked with Nuance, we worked with Aventura in that process, and we actually got our Epic resources online as well. And that, that was valuable because we were really able to quickly figure out that issue. We brought up Dragon, I think 2.3 is our version now, and that was able to manage that connect and disconnect, so that kind of roaming of the microphone or roaming of the USB issue kind of went away. But you do have to have that version of Dragon to be able to roam it.
Okay, I think that answers it. The next set of questions are on selection. I'll take one that kind of represents, can you elaborate a little bit more about why you selected Aventura and then air quotes awareness versus another SSO?
Yeah, I think it kind of goes down to that idea or that vision of a smart desktop. So it's not single sign-on is great, but I think to be thorough and to be able to enhance workflows, you really want that awareness to happen. You really want the system to be aware of who's accessing the computer, who's accessing the chart, what applications they have access to, and you want a system that is able to manage that and manage, all the other things that are required for roaming, so printer management, application access. So, I wanted a system that the end user could adopt quickly, but I also wanted a system that could grow with the organization.
Great, thanks. There was a specific question, I think you just answered it, but I don't know if you want to touch on it. It said in slide 11, can you touch a little bit more about what you mean about desktop intelligence? So I think you were talking about, if I look at slide 11, it was about printing and productivity and maybe desktop intelligence. Is there anything you want to add to the slide, those few bullet points?
Well, I think I kind of hit on it. It's one thing to be able to log in and single sign on to applications, but it's more important, I think, to know where you are when you're accessing that. So does that change based on where you are? So as an example, if a physician is in his office, do you want him to be able to access his email or servers or any other applications that are specific to him in his managerial role, as opposed to what do you want him to access while he's out on the floor? So that ability to change access based on location, change printing based on location, change the timeout based on location. So in the office, maybe it's a locked office, that physician has a 20-minute timeout, but on the floor, you still want to maintain the 5-minute timeout. So, you really want to almost equate the desktop to their personal smartphone, so that, knowing what they access most, knowing what I should show them when they're accessing it from a location, and what does that mean when they're roaming it to different places. So if I'm accessing my office and I have 5 applications open, I only want to open 3 applications when I'm on the floor. So that ability to kind of know who the user is, what they should have access to, and what they should have access to based on location is very important.
Great, thanks. Next, and probably the last grouping, unless any new ones come in, is around feedback. So there's questions specific to nursing feedback, questions specific to physician feedback. Any words of wisdom or quips about what the clinicians, what the users are saying?
Yeah, I think the biggest kind of words of wisdom I can give is know your environment, and this doesn't just go for Aventura or any other app. It goes for every application. When you introduce something new to an environment, knowing that environment is very important. So knowing the users and their habits, knowing how Epic is behaving prior, knowing how your network is behaving prior. So doing a thorough environmental assessment will mitigate kind of issues that come up. But also, if you introduce something new, those underlying issues get a bright light focused on it, and sometimes that bright light can be misconstrued as an issue with the new application, where it was really underlying issues that were there that weren't really present because something new hadn't happened in that environment and they were used to living with it. So, my suggestion with any application is to know your environment, know your infrastructure, and make sure that your systems are optimized before you introduce something new. That'll help with the implementation of that application, and it'll keep the clinicians from thinking that something went wrong because we introduced something new, but really probably if you dug deep, it was something that was already present. So you kind of, it's just optimize before you implement.
Fantastic, thanks. Well, I haven't seen any new questions in a couple of minutes, so I'll gather that we're questioned out. And I'll just try to end these a little bit early to give people some time back in their day. So I guess I'll say that concludes today's webinar. I'd really like to thank Scott for his insights, as well as for everyone else attending on the line and for your questions. So as I said earlier, we'll be following up and sending you today's slides. If you have any follow-on questions, my email is there on the screen, john.gobron@aventurahq.com. Please feel free to email me. I'll pass anything relevant on to Scott, or have someone from our team answer if it's a more Aventura-centric question. But with that, I'll say thanks again, and hope everyone has a great rest of their day. Bye-bye.